Hello, my name is Craig Ellingham and I am the author of Prostate Recovery Map, Men's Action Plan for guys who have undergone or are about to undergo prostate surgery. My background is in high-performance sports physiotherapy, and I've turned those skills of rehabilitation to the situation of men trying to regain pelvic floor continence and erectile function. This video is one of a series that accompanies the book to improve your understanding. The first video looked at the anatomy of the area and how to palpate or feel for muscle activity. The second video was level 1 of the 5-level program of how to engage the correct muscles with the correct technique at the correct prescription. This video is level 2 of the program, where we take the skills you've learned in the first level and show you a new way to exercise the pelvic floor muscles. If you haven't completed the first 2 videos or seen anything in the book, you'll get less from this video than if you could put them all together. For those of you ready to move on, let's go to level 2. In this third video, we're looking at the level 2 skills in the 5-level program, Prostate Recovery Map, Men's Action Plan. Video 1, we looked at the anatomy of the area. From the front, penis, scrotum, bladder, rectum, spine, prostate in red, pelvic floor muscle basin in green. The second video we looked at how to activate the pelvic floor with the correct muscles, the correct technique and the correct dose to train the pelvic floor for sustained holding of bladder volume. You remember I asked you to train at a slow ramp and then sustain. 30% intensity for a 10-second hold. That was the dose we looked for, but the key bit to go up slowly at the beginning, ramp it up gradually, and then hold while you breathe. Following this procedure activates what we call the slow twitch muscle fibers in your pelvic floor. And all the muscle cells in your pelvic floor have some slow twitch fibers and they have some fast twitch fibers. Slow twitch fibers have great endurance, they can hold for 10 seconds, and they respond best to slow switching on. If all you ever needed to do was control your bladder volume under resting levels, under walking around, sitting, lying in bed, you need only do these slow exercises. However, if you plan to cough, sneeze, laugh, lift, push, carry, you will have an increased load on your pelvic floor because all of those activities will cause downward pressure on your bladder quickly that needs to be reacted to by your pelvic floor quickly by clamping shut on the urethra and lifting and firming and holding there. So level 2 is about training the fast twitch muscle fibers of the pelvic floor now that you've mastered level 1, which was training the slow twitch muscle fibers. In this level, fast twitch, we use a fast switch on. We don't use the dimmer switch. We use a typical light switch where you flick the switch and on it goes instantly. That's what we're looking for this time. So no slow ramping. We're looking for, from here, I've had a thought to turn it on, to on. Instantly up. Okay, that's what we want. Instant switch on of the fast twitch fibers. We still only want 30%. I don't want you to do fast twitch, switch on, and everything works because again you'll start pulling in your belly button, squeezing on the bladder, and that's just going to add to your difficulty in holding the bladder closed to reduce your leaking. So it's instant on to 30% with your fast twitch muscles, and then hold, hold, hold. And again, we look to hold for up to 10 seconds if you can. Your fast twitch muscle fibers have not got a chance of holding for 10 seconds. They will fatigue within a couple of seconds of turning on. And when you start to practice this technique, you may feel rapid turn on, and then you feel, oh, I've lost it, it's gone. To hold for 10 seconds, you need to revisit your level 1 practice and switch on fast twitch, and as they start to fatigue, bring in your slow twitch and hold. We know slow twitch can do 30%, you've been practicing that. All it needs to do now is wait for the fast twitch to get tired. We'll take it from here, you have a rest till the next time. When you're about to cough, sneeze, lift, carry, push, etc., you're going to need this fast switch on. And you will only have it if you've practiced and trained for it. It doesn't come through doing slow ramping. It only comes with fast switch. Slow twitch then take over to give you a hold time. You may see from some hospital handouts or some other health professionals you visit that they're very good at teaching you the fast switch on, but then they say, then let it go again. Fast switch off. And then fast switch on again and off. And you get this cycle going for maybe up to the 10 seconds. On, off, on, off, on, off. Or pulses, they might refer to that as. That trains your fast twitch fibers to hold briefly and then to switch off again. To hold briefly, switch off. It's still training. But it's not the sort of training you'll need to stop yourself leaking if you have to pick up a grandchild and carry them across the backyard. If you have to pick up some shopping and carry it to the car. If you have to control a shopping trolley. Anything that increases your abdominal pressure and lasts more than a couple of seconds, you're going to need the slow twitch fibers to take over. So I get much better results with the guys in the clinic who master this skill of rapid switch on, no abdominal contraction, no flattening or hollowing of the abs, no sucking in, rapid switch on, and as the fast twitch fatigue, the slow twitch take over and head for the 10-second hold. In level 1, we talked about how you might not be able to hold for 10 seconds to start with and it would die away. And in level 2 we talked about how the fast twitch fibers switch on and then they fatigue rapidly within a couple of seconds, and you may feel them starting to let go and may not fully have engaged the slow twitch yet to pick up the load back to 30%. I think it's important to get the 10 seconds. And to get that, you may need to use a second grab. So when you start to feel it fading or switching off, make a double grip and you'll use your fast twitch again as much as they've recovered. Another effort to get it up and hold, hold, hold. Now that second grab may be early, and as you get more trained, you might find you go for a while and then it fades away. Nope, second grab, go again. You may feel the second grab from palpating underneath in the perineum. You'll feel the muscle starting to soften, second grab time. Or you may just feel the sensation internally because you've been practicing this for a while now, and I wouldn't be surprised if you don't even need to put your fingers behind the scrotum because you can feel internally when you're activating the correct muscles. You've got the brain feel, you've got the feel in your mind of doing it correctly. So listen to that. And if you feel it's starting to fatigue or starting to lose tension below the 30% as the fast twitch muscles fatigue, make a second bite, a second grab at them to engage again to complete your 10 seconds. The second grab is a useful strategy to keep training your endurance fibers, your slow twitch fibers, at the same time as you're actually doing a fast twitch set workout. And because this trains both muscle fiber groups, fast twitch, slow twitch, it's really all you need to do once you get to level 2. To master this skill of rapid switch on, no abdominal contraction, no flattening or hollowing of the abs, no sucking in, rapid switch on, and as the fast twitch fatigue, the slow twitch take over and head for the 10-second hold. When you can do that 10 times in a row, you have got good pelvic floor control, and I'll be very surprised if you're not seeing improvements in the amount of leaking that you're getting on a day-to-day basis. And you'll be able to tackle more adventurous or vigorous activities with more confidence.